Hey, Kris Brown here, Med Preservation Inc., coming to you live from a Hampton Inn in the middle of Mo. So on my last vlog, I kind of alluded to talking about the ASCII sort. And so for people who don't know what that is, it stands for American Standard Code for Information Interchange. And basically this is a table that allows the computer to sort pretty much every record that it looks at. This table will have special characters first, and then space, and then followed by the alphabet. So, when you think about an index or a lookup, something like on an app, when you're looking up into a table that lists all the states, uh, this is how the computer kind of ranks those entries. And, maybe it's not states, maybe it's days of the week or whatever it may be. Just anything with words or numbers in it, the computer looks to this table to kind of sort, unless it's predefined somewhere else. So, that is what ASCII stands for. I found a couple people lately that didn't know what it was or kind of how it related to pharmacy systems, and so I just kind of wanted to convey that information. It really plays a role in drugs and medication names, and when you're trying to streamline the ordering process for a provider, you want these names to be consistent. Oftentimes, if you have different strengths of a medication, you want those all to kind of fall under the same header. And the ASCII sort definitely plays a role in that. Also plays a role in building reports as well. So, the other thing that's been going on in my life lately is integrated testing. Been doing a lot of it. So I kind of wanted to talk to that a little bit. Um, I hear people say that you should try to break the system, but in my mind, it's not enough to just break the system. You should look for what's already broken. What's taking you twice as long to enter? What seems harder than it has to be, or harder than it should be? Because chances are that it's probably not set up right, or it could be set up a little better and really optimized to kind of streamline the EHR or the ordering system, whatever you may be working on. Once you lose a provider, it's really hard to get them back and to trust the system and to have faith in that system. And really, nobody likes to take longer to do their job than they have to. Definitely, that's kind of how I got into informatics in the first place. We had a computer system, and nobody was getting out on time. Got some super user codes, broke it open. Changed people's lives in about a month or so, 6 weeks. Got in there, got stuff set up. So I want to talk about like what I look for when I'm doing integrated testing, or really just building in general. And the first thing is patient safety, right? Patients always got to come first, but I try to treat the system like it would be my family member coming into the hospital that is being taken care of. And so I've obviously want it to be safe, and I want to help the clinician help my family member. And you think about it, these systems can last for up to 10 years. So you want to do it right. You want it safe. When you put something in there, it's pretty much there forever. It could be there for a decade. So if it's wrong, then there's a potential to really harm a lot of people. So patient safety is always first and foremost. And if you don't build it out right the first time, you may be changing systems in 3 or 4 years because people just aren't happy with it. So keep that in mind. Set it up safe and make it efficient, which is my second point. A lot of people in this business know that providers count clicks, and they will spend more time in a lot of situations counting clicks than actually doing their job. And I can't really say I blame them. I count keystrokes in what I do too, and I try to limit them. And when building scripts or whatever, I try to find the shortest amount of keystrokes to get me to the end result. So efficiency is definitely the second thing I build towards. And then the third thing would be financials, right? Because if we're not making money, then nobody gets paid. Hospitals not a good financial position. And so, that's kind of the obvious piece. So patient safety, efficiency, and financials, and really try to build towards that when you're building your electronic systems, and also when you're doing your integrated testing or parallel testing, and kind of flush that out of the system so it is much better for the end users when you go live. So with that, I think I'll sign off. So I just want to say, be kind, be careful, and always choose joy.